and welcome to this meeting of the Social Care and Health Select Committee. I am Councillor Marwan Al-Naji, the Select Committee Chair. This event is also being streamed live on YouTube, and members of the public and the media are welcome to watch the meeting and listen to the discussion that's taking place. I would like to welcome all those in the council chamber, and thank you for making the time for this tonight meeting, and to everyone watching from a distance and everywhere, sitting safely in your own home. As in all our meetings, it would be appropriate for us to start with a 72-second silence to remember those who lost their lives in the Grenfell Tower fire tragedy. So, start now, please. Thank you. Before we proceed with the meeting, I would like to ask members of the committee to only switch on their microphones only when they are trying to speak or called to speak, and to turn them off after they speak. Please remain seated when you are called to speak. Do not stand up. If a councillor wishes to speak on a particular item and has not been called, please raise your hand or call my attention. I will move now to the A1 item on the agenda, apologies for absence. Any? No, thank you. Item 2 on the agenda, declaration of interest. I have one declaration of interest regarding I am alumni of Brunel University, and I have wider engagement with Brunel as well as other universities as an academic. Any member have a declaration of interest? Christine, yes?
Yes, I am the Health Watch representative on the North West London CCG Quality Committee.
Thank you, Christine. Anyone else? No. Okay. Item A3 on the agenda, minutes of the meeting that was held on the 28th of June 2021. The minutes has been circulated. All members of the committee agree to it to be signed off as a true record of the meeting. I take silence as approval. Thank you. Any matter arising? No? So we'll sign them off later in the meeting. Item A4 on the agenda. And before I move on to the item there, if for any emergency or any particular reason I have to leave this meeting, I will call to my Vice Chair, Councillor Addenbrook, to take lead on this meeting. Thank you very much. I move on to item A4 on the agenda, and this is a presentation by Dr. Anna Kanhoto and Ms. Donna Mary Holder, who are the part of the research team led by Professor Danai Manika of Brunel Business School. And we have a presentation by them, which I will encourage you later to ask questions and just give you, for those who are interested in this, why I reached out to my colleagues at Brunel. I reached out to them not to this particular research group, but previous group when I struggled to understand the complexity of different issues after I became councillor in Nottingdale, in North Kensington, after the Grenfell tragedy. And we were planning a conference, so I reached out to some colleagues in the business school, and we were discussing a conference dimension, including all diversity of our functionality in the area of as a public service. And we had several meetings. It was gaining momentum. Then we had the pandemic. And this pandemic has caused and elaborated the difficulty we are facing in North Kensington as a traumatized community. So I reached out to some colleagues who gave us a brief presentation earlier, and we need to conduct further research in the surrounding area of the 500 meters defined around Grenfell Tower. And that's what was my main focus, walking around to businesses. So I reached out to the Innovation Center at Brunel University, and they were helping some local businesses with some fantastic work over the last 2 years, from electrical vehicles to supporting startups to businesses at no cost to them, and these are through grants from Brunel University. So here at this point, I'm really grateful to Brunel University and Brunel University team to support us in the council, to put our council in the best light of that we are here working with residents, with different stakeholders, and holding the decision makers to account for the best of our residents. So without further ado, I call Professor Manika to introduce her team and to give us this presentation. Thank you.
Hello, everyone. Thank you. Hello, everyone. Thank you very much, Councillor, and thank you very much, the committee, for having us here. We really look forward to presenting our findings and discussing with you further what we can do to improve the council and support residents. First of all, I would like to start. So my name is Danai Manika. I'm a professor of marketing at Brunel Business School. My colleague.
My name is Anna Canhoto, and I'm a reader in marketing, do research in the realm of digital interactions.
Hello, my name's Donna Marie Holder, and I'm a doctoral researcher in education, and I'm also the research assistant for this team.
Thank you very much. And of course, we have two other research members who were not able to be here with us today. That's Dr. Emma Wainwright and Dr. Geraldine Cohen. And together we are a team from Brunel that we got funding from the Global Lives Research Center to conduct some preliminary research with residents of the council based on consultations that we had with the councillor. Specifically, we wanted to explore digital technology interactions between residents and the council and try to understand during the COVID-19 pandemic their expectations, their experiences, and how this could actually contribute to well-being. So we're here to present to you our preliminary findings as the research is ongoing. Next slide, please. So what are digital technology interactions? They're in essence any digital tool out there that the residents can use to interact with the council, whether that is, for example, the council's webpage or different social media that allow communication from residents to the council, but also from the council to the residents. In this particular project, what we wanted to do is to clearly understand the expectations and the experiences that residents were having during the COVID-19 pandemic about the interactions with the council, as well as to explore how this could potentially influence residents' well-being. The second aim of our research was actually to look at differences that potentially might exist between residents within the 500-meter circle of Grenfell Tower and outside. So our aims were twofold: understand in general expectations and experiences and how they could contribute to well-being, but any potential differences because of the diversity that residents have in the council. This is important because we had a couple of events that could have contributed to kind of potentially decreased well-being, so COVID-19 coupled with the Grenfell Tower tragedy. And of course, also due to the lockdown measures as a result of COVID-19, digital interactions became very, very important. And in that way, we wanted to really explore this kind of new phenomenon of the interactions and how they developed and how could they contribute to the residents' well-being during the pandemic.
So I'm just going to briefly discuss, thank you, the next slide, the approaches and the findings. So ideally, what we did and what we are still doing is we're conducting interviews with our residents. So the interviews are actually in progress at the moment. We've also looked at the digital presence online, and ideally that's been through the social media channel of Twitter. And we've analyzed that data from January 2020 to May 2021. And we've also conducted interviews with our councillors just to scope the project in a bit more detail. What we can present to you now is our preliminary findings, which we've grouped into 6 themes: proud residents, differential impact of COVID-19, and all of these will go into more detail as we go along. The 500 meters within Grenfell, also within 500 meters of Grenfell Tower, the residents are more digitally engaged, and that's really something that we want you to hold on to, and we'll expand upon that as we go forward. There are different needs and experiences of digital technology and interactions within the borough of RBKC. Residents want more digital, and also there's limited engagement on Twitter. So I'm going to hand over to my colleague, and I'll also interject where I can with some more explanation.
So the first theme we wanted to explore, it is evident to us from both the interviews we are conducting with residents and the analysis of the social media presence of these residents that they are very proud residents of the borough. They really, they feel very fortunate to live here. They love the diversity of the borough. They think it's an exciting place to live. So this is what they have in common. Then the other thing they have both talk about is the amazing facilities in the borough, though they value different things here. So those in the Grenfell Tower talk about education, culture, parks. Those beyond those 500 meters, they also talk about the restaurants and the culture, all the theaters and the supermarkets. So they talk about all these facilities. Both groups talk about they like it because they feel connected, though they then translate, this has different meanings for each group. So those within the 500 meters, they talk about being connected to others. They talk about a sense of family, a sense of community, of belonging. Whereas those beyond, when they talk about connection, they talk about public transport, how easy it is to get somewhere, how easy it is to be connected to anywhere in London. And then where they are different is that those at home then talk about feeling at home, that they like here because it's home, it's family, it's easy, an easy place to live, and the others talk about mostly about convenience. It's something that emerges. And this is evident, as I say, in the images that the residents share online. You'll see, if you could go back to the first slide, to the previous slide. So both those within the 500 meters and beyond, they share photographs of where they live, of their journeys, of their neighborhoods. So clearly a place that they enjoy living. Then the next slide, so this is where they are similar. We looked at, so the next point, we looked at the residents' well-being, and we looked at 2 things. One is the subjective well-being as defined by the World Health Organization, and then issues related specifically to COVID-19. In terms of subjective well-being, we noticed that those, so in the blue color, those within the Grenfell Tower Circle, they reported actually slightly higher subjective well-being than those beyond, which is interesting. And then when you unpack why, it's because they feel connected. They talk about having lots of interests. They talk about feeling in good spirits, though they're also likely to report feeling less rested and less energized than their neighbors beyond the 500 meter. In terms of specific concerns with health anxiety, clearly it's very interesting distinction that those within the Grenfell Tower, they reported a more negative effect present and past. So they were very anxious. They talked about disruption to daily life. It clearly had impacted their well-being. However, more than those beyond the 500 meters. However, those beyond the 500 meters, they were more anxious about the future. And they talked about issues like going back to work, right?
I would say for some of the residents within the 500 meters of the Grenfell Tower, a lot of their anxieties came from this feeling that they had to manage the difficulties of the Grenfell Tower tragedy. So they were feeling quite anxious that with COVID-19, this was another extreme circumstance that they were having to navigate and deal with. And that made them extremely anxious. It made them extremely nervous. And at times they were really worried. They felt that, you know, some of their concerns weren't being valued or listened to because they were still dealing with the tragedy of Grenfell.
Next slide, please. So something else that was quite different between the two groups is their level of engagement. When you ask those beyond the 500 meters, they have very limited awareness of the council's, the borough's online presence. They say, oh, I think they have a website, and then they didn't know much beyond it, and they really didn't want to know. I don't want to know, I don't want to follow, it's enough. Right? Whereas with the other group within the 500 meters, they are extremely aware of all the tools, all the platforms, all the accounts, all the usernames. And why? Because they use it a lot. They use it a lot to access resources. They use it a lot to help each other, to coordinate with each other and access and share resources. So they talk about, not only do they know all the websites and emails and accounts, but they talk about the food bank, they talk about WhatsApp groups, they talk about apps for residents. And they themselves will share information like the one illustrated on the right-hand side. They will share information about how to act, about what's happening in relation to COVID, attention. Boris Johnson might ask for a lockdown, be aware of how this might impact you. So, on the other hand, we could also find an evidence of digital divide.
Absolutely. So there's a few things to just expand upon here. The residents within the 500 meters of Grenfell really expressed this sense of connectedness and sense of community, and they were really keen to express that they used WhatsApp groups and a lot of ways to kind of keep in touch with each other. So that those digital means were really important to them. They did express that one of the reasons they were so important is because a lot of the times they've had to be proactive in finding out information with regards to the Grenfell tragedy or just getting information with regards to their local community in general. So they're very much connected digitally and they want to continue to do so. There was also a real push to expand upon a digital divide. And by that, what I wanted to stress here is that a lot of the residents, or participants, I should say, who took part in the research, were saying that there's a difference between the ways that they access and use digital technology to interact with the council. Some of them, unfortunately, don't have the means to access the council digitally. So whether that's using a phone, a laptop, but also don't have the skills or the competencies to be able to do so with confidence. And that was something that they stressed a lot. We have a lot of vulnerable residents, they said. There's a lot of elderly residents, residents that may need additional support. And therefore they felt that, well, they're not able to access the services and any of the means that they have with regards to the council online. And that was something that was really key throughout, if not all of the interviews.
And the fourth point, we also investigated how, for what ends they interact with the council, and then where is digital helping or is actually making them more stressful, more stressed and more anxious. And here again, there was a very clear divide. Those outside of the circle, they reported interacting with just occasionally and for very transactional purposes, using a very limited range of channels. So example, they would go on the website and pay for the parking permit, or pay for the council tax, or they would go on the website to report noise nuisance. So it is something very contained, very occasional, on the website and very contained, done. You have a sense of closure, right? So here the website is helping them solve the problem. For those within the 500-meter circle, then they reported interacting a lot with the council and using lots of different channels. So they talked about website, they talk about emails, they talk about apps, they talk about social media. Zoom was mentioned by many, right? So they used lots of different channels, they interacted a lot, and they use it for highly emotionally charged tasks. So they talked about, for instance, I needed repairs to my council house. We talked about because of the Grenfell Memorial. So when they approach the council, they are already in a sense of anxiety and stress. And then the interacting with the council this way doesn't help. Why? Because when they need to interact with many parties, information gets lost. It's very complex. They report in many situations their information would get lost and they would either not be solved or something would go wrong. Like they asked for parking permits for 12 months and then they only got 6 months and then the second person didn't know about the first email. So there's where here it's not helping, it's actually creating more confusion and more stress.
Residents within the 500 meters as well felt that by using those social networks and those social channels meant that they would get a response immediately. It was almost as if to say, well, if we put this online, someone's going to see it, someone's going to respond, and it gets to a wider audience as well. So those residents within those 500 meters are quite confident in using those channels to get a response or to be proactive, sometimes also reactive as well.
And then point 5. So despite this difference, both groups really want more digital. They like the digital presence, they think it's a must, it's an important resource, and they want it to continue. And reasons for that are like convenience, because you can solve the problems at any time, from any place. They also talked about how it helps them participate civically. So for instance, we have a resident outside of the circle say, yes, I can join a council meeting without having to sort out childcare. Someone within the council said, yes, I don't need to miss work, right? So they can participate in these meetings and be informed and voice their interests through the digital, which is, and it's interesting to see because I noticed on Twitter that you're moving towards more resumption of the physical meetings. They also would like more services, so both more variety of things like art classes and so on. And they would like more automation. They would like to be able to solve more things online without having to interact with someone. So parking permits, and they'd like a chat system like Amazon. This is something that we find outside of government in other fields as well.
And as a follow-up to that, as I've mentioned earlier, as much as residents want more digital, what's really key to that is they want digital that works for them. So it needs to be fit for purpose. They need to know how to use it. They need to get the support. They need to know, how does this work for me, or how do I need to get online to find out this information? So it needs to be simple, straightforward, and straight to the point. There were some residents that were quite clear to make distinctions between, I won't say what other platforms, but this one works really well, we need to do something like this. So it needs to be fit for purpose, it needs to be simple, and residents need to get the support to be able to use it as well.
And finally, we looked at the online presence of the council, we looked at the website, we looked at various social media accounts. Here I'm just reporting on Twitter because that's the only one. We collected all the tweets since the beginning of January and looked at the themes and the frequency and the engagement, so that's what I'm reporting here. We noticed that the borough's Twitter account is extremely active. There were more than 4,000 posts in 17 months, so that's well above at least 5 posts per day, which is quite intensive compared with other similar organizations. Not only is quite active, but there is a very broad range of topics. So there are tweets that are about information and support. For instance, this is where you can get your vaccination, your COVID vaccine. There are action tweets like go and get your vaccine by the Science Museum today. There is civic engagement like what are you worried, what are you concerned about, tell us what you think about this. And they also answer to question and answers. So, but what's happened here is that it's so diverse that it's actually there isn't one common there isn't a clear message or a clear topic coming through. So when I group the topics of discussion by common themes, the most I can get is 2% of all the tweets will have the word help, support, need, please, no. So what it shows is that maybe it probably is too noisy. This makes it extremely difficult for residents to find something because there is such variety. It's so noisy, it's difficult to identify something useful. So 2% were about around this theme of help, support, and so on. And then action, go and get your vaccine, get your tech. Of course, this wasn't just vaccine, it was also other things, right? Go and get your support, apply now for, get the newsletter, things like that. And things related to COVID coronavirus specifically, they only took 1.96% of the tweets. So you see, given the significance of these, of COVID in the residents' lives in the last 18 months, it's a bit surprising that it's only 1.96 of the tweets. In terms of geographical areas specifically mentioned in the tweets, the most common were Kensington and Chelsea, perhaps unsurprisingly. But then interesting, you see that Grenfell only occupies 0.09%. It's half of, for instance, Notting Hill Carnival. Notting Hill Carnival was mentioned twice as much as the word Grenfell, even though there was all those, the report and things like that. Most of the posts don't get any reactions, or there's just a handful. Only 7% of followers engage with posts. What are the exceptions? Well, there were two mentioned in March 2020. There were 2 posts that generated a loss of reaction. They were about the Club for Carers and a possible scam related to school meals. And then March 21, a missing persons appeal. And in April 21, the Duke of Edinburgh funeral. So what we see here is what gets a reaction is highly relevant, highly practical information, which is not necessarily what's occupying the account. So those are our findings in the last slide. I want to emphasize these are our early findings. We're still conducting interviews, but we wanted to share them with you and hear from you how we can contribute to the health and well-being in the borough, and have any comments, suggestions. Welcome.
Thank you very much for listening.
Thank you. This is excellent. Thank you for sharing these preliminary results with us, with the committee here. I'm sure that we have some questions, if you don't mind. We'll open the questions to committee members first, then to the rest of the councillors. Councillor Woodard, please.
Thank you, Chair. I thought the presentation was very interesting, some interesting stats and comments there. I'd be curious to know which social media platform you think is the most effective for interacting with residents. I mean, you mentioned that practical information gets the most reaction. I wonder if a platform like Nextdoor might be one of the most effective. I know that Colville Ward, I think, has the most number of members of any ward in the borough on Nextdoor. Unfortunately, Queensgate, my own ward, has the least numbers. But some of that, I think, is partly linked to age group. But I'd be curious to know from the findings.
Yes, that's absolutely the key message. Is that, for instance, we noticed that Facebook and Twitter have very similar content, and different platforms should be used differently because they have different audiences, they have different characteristics, and Twitter should be more for these kind of very practical information alerts that are very relevant, whereas Facebook would be more, maybe you could have groups for certain neighborhoods, or Nextdoor, it's an app that was mentioned many times by the residents, both groups. So definitely, what our message would be that when we think about digital, we need to use different platforms for different purposes and audiences, rather than a one-size-fits-all.
Thank you, Anna. Councillor Williams, please.
Thank you. Yes, can you tell me the number of people that you interviewed and contributed to this study, both in the minus 500 and the plus 500 groups?
So at present, we've been able to conduct 7 interviews. I've got another one tomorrow, you'll be pleased to know. And there are 5 outside of Grenfell and 2 within.
I'm sorry, I couldn't hear that
Oh, sorry.
at all.
I'll come a little bit closer. Is that better?
Yeah, better.
Okay. So far we've conducted 7 interviews. We have another one scheduled for tomorrow. And we've conducted 5 outside of the Grenfell 500 metres and 2 within.
So the findings relating to greater use of social media were based within the G-500, were basically based on only 2 interviews?
Also analysis of online conversations as well. So whenever...
I mean, it's interesting, but I just wonder how reliable that is.
Of course, we understand that this is only preliminary. We did say that we are actually conducting further interviews right now. So we're just declaring that, yes, our findings are based on a limited amount of interviews, but also analysis of social media. And we're actually continuing this work. So we would very much welcome any idea that you have or any area that you would like us to explore further in the coming interviews. So we have actually been able to secure further funding to continue the interviews and the work and be able to provide more concrete kind of findings and evidence. Thank you.
Councillor Spalding, please.
Thank you, Chairman. When you're doing sociological research and analysis like this, surely the first thing you've got to consider is your sample size. Do you have a sample size in mind that would make your findings reliable?
Yes. Originally, the research said that we're going to conduct 24 in-depth interviews. So that is an interview that lasts more than an hour. And also we were going to combine that with social media data, as well as desk-based research to be able to have some findings that have some concrete evidence.
And just to follow up, Chairman, how then are you going to guarantee that you will remove any bias from your sample? I mean, what steps are you taking to make sure the sample is, one, truly random, and two, truly representative?
Thank you. Wonderful question. We should declare that our sampling method is not random sampling, it's actually convenient sampling. So we have, in essence, decided to approach residents via social media. We actually had an advert that went out via the social media accounts of the council and invited, in essence, residents to participate in our research. So it is convenience-based, it is not random-based. So that is a bias that unfortunately is part of our research design.
Then, with respect, Chairman, I mean, I have to say, I'm sorry to say it, embarrassed to say it, but I think the size of your sample and the lack of methodology about bias really devalues your findings. I'm sorry I had to say that.
Yeah, thank you for this. We understand the limitations of our research. We were invited today by the councillor to show these preliminary findings, and we did actually say that they are not finalized. So we do understand exactly what you mean, and we are saying that, yes, we're not ready to present them, but these are the preliminary findings so that we can all discuss further action on this. Thank you.
Yeah, thank you, Councillor Spalding. That's a very important line of questioning there from committee member regarding qualitative research. And when you are conducting this particular research, it's not like a survey or a statistical validity. What I can see here is establishing the themes for further research. You are just picking on the ground, and this is valid in terms of qualitative research. Digging deeper, establishing themes, which is there, knowing the limitation, as Councillor Spalding and Professor Monica, you highlighted and interacted on that dimension, and as long as this is defined at the outset, this doesn't invalidate the finding, although it is limitation, because of the concentrated effort. So you might move the next step to do a certain survey within a particular theme which is emerging. So basically here what we are seeing is a triangulation of different themes into that area of research, and I'm glad the research team taking the Councillor Spalding observation into account, and I really thank you for that. Councillor Attenborough, then Councillor Atkins, please.
Thank you, Chair. I have a number of questions. You mentioned that it's limited engagement on Twitter, but can you clarify what benchmark you are using to measure this? And then going back to the number of people that you've interviewed, it is limited, obviously, but have you reached out to, so during the beginning of COVID, we realised that we had a lot of digitally excluded residents, vulnerable residents. So our housing team were knocking on people's doors And I think, within that 500 metres, you've got a lot of people in that category. So I'm not actually sure whether a digital is the right way to look at this, because it's so many people that are just digitally excluded. And it concerns me that we're going to look at this and base decisions on it, and
So,
it's not reaching the right people.
So two things. When we do qualitative research, we don't need to have random sampling. We need to have representative sampling. We want to interview people that represent the issues that we're trying to identify. So, right? So we don't need to have random sampling. It's not a criteria in qualitative research. But we do need more interviews for sure. In terms of what you said, the people that are excluded, yes, that's an issue. Because we are looking at digital interactions. So because we're looking at digital interactions, we need to look at people that are using digital to interact with the council. So it's right that you're right that there are people that are not using it, but that would be a different project about why are they not interacting, what could be their issues. What we're looking at now is, because the council has a digital presence, how is this being used by the residents? Do they use them in different ways? Do they have different needs? Do they have different concerns? And this is the digital presence helping those residents with their needs. And what we find is that for some, yes, because it enables them to solve problems. For others, because they have very specific type of complex, highly emotional problems, it's not necessarily helping them. So that was the remit of our project, was to analyze the digital presence and how the residents interact with them.
Thank you very much. I think I will leave it there.
I was just going to say, I would encourage you to speak to the local residents association around the tower, because they will be able to help you find people to take part in this.
Yeah, we did reach out to them.
Yeah. Thank you. Councillor Atkinson, then Councillor Bakhtiar, please.
Thank you, Chair. I must say, I'm not quite sure why we're having this presentation tonight at such an early stage, and I would agree with what the other councillors have said, to even seek to draw preliminary conclusions on the sample size of 7. I don't think has any great validity, and far be it from me to boost the reputation of this council, but I actually think that the council has devoted an enormous amount of effort into making sure its consultation around Grenfell has become meaningful, and I will continue to pay much more attention to residents' panels and this type of thing. Actually, we should be boosting what we've done ourselves, and I wish you well in terms of your own academic studies, but I must say, I don't think this is very much use to us at this stage.
Thank you, Councillor Atkinson, for that observation. What we are trying to do here is to give you the platform to see what other engagement, other stakeholders from that dimension they can offer us for different themes, working with the council officers, things happening on the ground. So I will take that point. Councillor Bakhtiar, please, then Councillor Kamali. Then we go back to Wujjar, and we'll finish at this point. Yeah.
Thank you, Chairman. Thanks for coming to address us this evening. And I think none of us is qualified to assess an academic research or paper. We shouldn't do that, because what you are doing is different from council or government consultation. What you are doing, you are academics doing academic research. So thanks for doing that. Thanks for coming. But I would like to suggest something to you, which you've asked if we have any suggestions. In my view, despite the technological advances, human interaction is the best until this moment. So if you focus on your effort on that and try to engage with those who are not accessible, when you set a date, a time, inviting people to come to you, there are certain individuals who will attend all these consultations or interviews. They're everywhere. If you Step outside the box. Try to reach out to those who are normally not accessible. You might find more information. Thank you.
Thank you very much for this suggestion. Thank you.
Thank you very much. Councillor Kamali?
Thank you, and thank you for this. I'm sort of drawn to the figures on slide 6 around the engagement on Twitter. What I find a bit, I sort of added it up, and it only came to 7% of the content that was put out on Twitter has been accounted for in these search terms. And having been in at least half a dozen or a dozen COVID-related videos, when we take 2%, it only takes us to about 80. And so I was just wondering, are we out by a factor of 10 on these figures? Because where are the other 93% of the content, would be my query.
So we used a crawler. We collected 4,000 posts from the Twitter account, from the handle. And so when you say you had 10 more than these, those were all the ones we collected with Python with an automated crawler. There were 4,000 posts started by the handle, not by others. And then from these, when you look at the terms used, then you start, so you use software to look at the terms used, and then you start adding them up, and the word COVID was 1.96% of the posts, right?
Thank you. I think, though, that has left a 93% error in the search terms. And I mean, we've been very keen to make sure people are getting tested, people are getting their vaccines, people are coming to the town hall, etc., for our testing centres, going to the Science Museum. And I've personally witnessed more than 80 posts on that topic, far more in excess. So I would say in your further research, please could you perhaps check the scripting on this one, because I find it extraordinary that 93% of our Twitter is not encapsulated by Kensington, Chelsea, COVID, help.
Yeah, we'll be very happy to even share the data with you and look at it together if you want. We'll be very happy to do that.
Okay. Thank you, Councillor Kamali, for that pushing regarding quality of data there. And Councillor Woodger, and the last question from Councillor Spalding, please, on this.
Thank you, Chair. One other thing, which since this is digital technology interaction analysis, I'd be curious to know if they can look into potentially what type of technology the user is using, whether it be a public computer, a personal computer, a phone, a laptop. There's probably something you can probably better measure if you were to go door to door and actually ask, because obviously some people won't have some of these things at all. So it's how they're using the platform they're using to use the social media or not is something worth measuring, as well as what happens on social media itself.
Thank you so much for that comment. So we have been asking those questions. We didn't kind of put the information on there at the moment, but we have been ascertaining that majority of the residents use their phones or they use laptops. But it is something that we can drill down further as we continue. Thank you.
Councillor Spalding, please.
Thank you, Chairman. I wanted to end really on a really positive note, because what's really impressed me about this, which I hadn't quite realised before, is that a lot of councillors and officers in the council see social media as a means of conducting business, reporting issues, sharing emails, Zoom meetings, and so on. And what you've actually uncovered, I think, is something very important for us. And that is that for a lot of our residents who are disadvantaged or isolated or in some way not able to interact socially as fully as other people, that social media are truly social, and that it can be a social lifeline for some groups of people, and it enhances their lives. We know that 50% of this borough is single-person households. We know that 40% of this borough is single household of over pension age. And I just wonder if you've uncovered something very important whereby we could enhance social isolation problems, overcome them by some kind of enhanced social media interactions. And I think that's a really valuable thing that you've brought to us this evening, so thank you.
Thank you very much for this positive comment, and we really appreciate the committee's comments, both positive and negative, and we will try to address our limitations as we move forward. But just wanted to highlight, as with every study, there are limitations, unfortunately. But thank you very much for all your comments and feedback and having us here. We really appreciate it. Thank you, Councillor.
Thank you very much. To finish on a positive note, I would not see some of the points mentioned in any way critical because of its preliminary research working with us on this. So please do take the points from different members as professionally as you can, and especially from the lead member who is worried about certain contents and being presented. So hopefully that will be clarified to the committee, including the lead member, because if the council is doing a certain work which is not highlighted, we had the opportunity from the lead member to feedback on this. So this is, I don't see it as a negative feedback in this system, but it's more engagement with you and on what Councillor Spalding highlighted. You brought to us a different dimension with due respect to Councillor Atkinson, who did not see a full benefit outside the box, but he has every right to highlight certain specific about this level of engagement. So we need to take every comments being made here into a broad and in a positive way for future engagement. Especially we are addressing a very sensitive issue around Grenfell. Our community is really traumatized and we are having we are away moving from the lockdown now, but this is not an easy release of pressure. I am really worried and concerned about the mental health dimension, which is the propagating theme throughout our meetings for the future. But may I, on behalf of the committee, to thank you for being with us tonight and supporting our work and for the best of our residents. And I extend that warm welcome for you being here in person, in presence, taking that journey all the way from Uxbridge to here to join us. So thank you very much on behalf of all of us, and very kind. Thank you. You are welcome to stay or leave as you wish to continue our agenda for tonight. So without further ado, we have taken more than I expected for this item, but I hope it's of some benefit. We move to item 5, which is the lead member paper on the update from Councillor Kamali. So I invite the lead member and Anna Rolay, who's the Director of Public Health. She's here with us. No, not tonight. Anna. Oh, we have Viswa. You're welcome. So it's over to you.
Thank you, Chair. And obviously the size of the report today highlights just how much work is going on in the portfolio, not just in Kensington and Chelsea, but also nationally. We've obviously seen recently government has finally worked towards addressing the difficulty of funding social care, something which is acutely impactful on Kensington and Chelsea, which has an older than most demographic and an increasing need in that sector. I start by sort of drawing out a few key points. You'd have seen recently that the WHO has rightly brought forward tighter air quality guidelines on clean air, and it's one of the few topics that I agree with the Mayor of London on, in that providing clean air is much like providing fluoride in the water. It's something that we can offer universally across the borough to all of our residents, and it is something that we can all benefit from. So I'm very happy that one of the priorities inside the report is a refocusing of the public health grant to take air quality much more as a challenge to surmount rather than something that we work around. You'll also be aware that another part of the Council has recently launched a Green Fund. The Council itself has committed to a climate emergency, but climate is clearly national or international. Air quality is very much local. And I believe that we can work together across departments to make sure that we are both treating the climate, but also treating air quality. And I'm looking forward to proposals coming forward in the near future about, in particular, schools in areas of high air pollution. And I will also be working towards Mayor of London funding where it's available for these topics. Obviously, one of the key items in the report is COVID. But in fact, I think it's worth drawing out the impact COVID is having on other functions within not only the NHS, but within the Council as well. It's been it's had a huge impact, obviously, on our residents and on our officer staff as well. But what this has had repercussions into mental health, which is also a priority for myself in the report. It's also had impacts on obesity, people having different levels of activity during the pandemics and lockdown. And so what I'm trying to coalesce around on all of these various priorities is not just how we've handled COVID, and I believe Kensington and Chelsea has handled it well, but to make sure that we can use it as a springboard to tackle some of these slightly more deeper-rooted issues that we have in our communities. There's a variety of information and figures there on the COVID case rate. Of course, that's somewhat out of date as it went to print. I'm heartened to see that the case rate amongst our over 60s still remains at about half the rate of those below, a testament to not only just the number of our residents that came forward to get the vaccine, but also the vaccine's effectiveness and efficacy. And really, there's an awful lot in there. I think there's some things to be proud of. This new community health workers in our estates, both in Chelsea Riverside and in Golborne, I think is going to be really interesting, borrowing from a model, as I understand it, from Brazil, to really track people's health and make sure that they can reach it where necessary. We always have to keep in mind that mental health is something that we know is an issue in the borough. We know it's an issue that's increased in prevalence across the country. We're not necessarily seeing it coming through in the figures, but one has to assume that there's either an issue on analysing the figures or people are not coming through ordinary pathways. So I'm sure our NHS colleagues might be able to elaborate on that. But it's clearly something that is acutely felt in the community, and I'm glad that the recovery board that was set up with £8 million of funding has put mental health as one of its key task and finish work groups, and a number of projects are being funded and will be coming through shortly. I am aware of the time, so I don't want to go on, but I'm obviously very happy to take questions. And thank you, Chair.
Thank you, Councillor Kamali, for this brief outline, signposting us on different priorities, and I'm glad you are really pushing for overall collaboration on air quality, pollution, and schools. And now we have opening up on this, so it's fantastic. I will open the questions first to Councillor Williams to start.
Thank you, Chairman. Yes, can I ask about the measures the Council is taking to prevent the spread of COVID, particularly amongst children of secondary school age, because I think where there is the moment the highest level of, this is nationally of course, highest level of infection, and of course the danger is that it spreads up through the generations and leads to the hospitalization of people who are vulnerable. Obviously, one part of the strategy is vaccination, but I mean, I know in earlier stages of the pandemic, we did do a lot of work with schools to help them prevent the spread of COVID.
Thank you, and you're absolutely right. Obviously, as the vaccines are so effective, the unvaccinated become the sort of the leading cause of the increase in case rates. Children obviously have, the rules around schools have changed somewhat from national guidance in that it's now just the positive person that will be going home, but our public health teams, and I'm sure if they were here, would be able to elaborate even further in that we're still operating our outbreak management teams. We still have a number of schools which classify as needing that support. I was just informed of one today as well. Fortunately, of course, I wouldn't even say fatality rate, but the impact of COVID on that age group is that much less impactful, sorry to reuse a word. And so what we have also focused on is, of course, our care homes, and I believe we're one of the first councils in the country now that is putting in air purifying systems into our care homes to make sure that they have filtered air. That is something that, in talking about air quality, one could also look to perhaps offer into schools as well. Of course, clearly schools sort of operate independently as well, but I believe that there's a positive impact in the way that we all now perceive air quality, that we should not only be keeping COVID out, but also keeping out all the other particulate matter and other pollutants from the classroom. So that is again something that I'm really keen to tackle going forwards as a sort of a good learning of COVID. But I would say that the public health teams remain incredibly responsive to any school outbreak, and parents as well are testing routinely. You can see daily, I believe we have about 1,300 lateral flow tests are done a day in the borough, with close to 1,000, or over 1,000 PCR tests being done as well. So if you consider that's 14,000 tests a week being done in a population of 150, it's quite a significant number. So I believe our messaging on encouraging people to get tested is also paying dividends there. So, thank you.
Thank you, Councillor Kamali. Christine, then Councillor Woodger, then Councillor Atkinson.
Could you give us an update on the Afghani evacuees, and particularly on the access to healthcare plans in the short term and the long term?
Yes, so firstly, I'm very proud to say that we are supporting up nearly, I believe, 800 Afghan refugees within Kensington and Chelsea, predominantly in government-managed hotels, actually very close to here as well. And we've also committed to a number of homes to be provided for the longer term. But I believe Visra is much more ear to the ground on this one and has been attending a number of the the work groups.
Just to add Councillor Kamali's answer, that we got goal meetings on a daily basis to make sure those people in the bridge hotels are looked after. So we've been doing welfare assessments. So our officers are on site on those hotels, talking to the families and individuals, and we know that there are more than 50% of the people there are young people, so we're looking at their needs and trying to provide what they need. But we know that it is a bridge hotel, so they will be moving on to their permanent places. But I'm also pleased to tell you today that we are also working on vaccinations with the CCG colleagues. I think that we're starting from tomorrow. There is a vaccine buses in front of one hotel, and also we are bringing people from other hotels to the vaccine bus. So we will continue to do so with working in partnership with NHS colleagues. So there's a lot of partnership with NHS on this, registering GPs, providing primary care, and also Children's Service has been doing a fantastic job, and they've been visiting and interviewing families and providing all those. And we know that there are so many unaccompanied children, so we're taking safeguarding matter very seriously. I think it's about the numbers. It's about 860 people and 464 families. But numbers, Councillor, is changing on an hourly basis. So that's what I know as of today. So the numbers are changing every minute. So.
Thank you very much. But we need to keep our eyes on number changes as well, so at least we can keep track of increase or decrease as the matter arises. But thank you very much for that feedback. Yep. Councillor Woodyard, then Councillor
Thank you, Chair.
Atkinson, please.
My question's on the new health and social care levy, or tax, I suppose, which is a good thing, but the question is in terms of the details of it and how it affects this borough, because obviously a lot of our residents are, their main assets, their home, and if you obviously look into the details here, I'd be curious about the numbers in terms of, with those assets under 20 grand, will be fully funded by the state. So, I mean, how does this work in practical terms? I mean, obviously this is very fresh and new. I wouldn't expect you to have a concrete answer, and I'm sure we'll be looking at this in future meetings. But if you can give me a sort of general picture, that'd be helpful.
Thank you. And I think we can probably all agree that whatever our politics, we do recognise the need to tackle social care across this country. Yes, so obviously the proposals are still very fresh. I'm very keen to find out exactly how it's going to be operated, not least to make sure the passporting of the funds do come through in a timely manner. I'm also very keen to see exactly how the government will be allocating that funding, because obviously London care costs are very different to other areas of the country. I think for us locally, my immediate concern, should I say, is that I believe this is, whilst it's positive that care will be obviously provided, I'm a little nervous of what it might do to our local market, because obviously we have a number of private care homes, we have a number of operators that have contracts with us, and we also have a slightly difficult market at the moment to find care staff, as you'll have seen also in the report around the compulsory need to be vaccinated. So by sort of widening the net, let's say, on the funding side of it, I'm hopeful that it will mean that families are able to get the support that they need, but that likely means there'll be an increased demand on our services, on the council services. We have to meet that demand from somewhere. We need a vibrant functioning market to be able to resource that adequately. I've been in conversation with Councillor Folkes about putting on a care fair in Kensington to try and recruit people locally to this deserving market. I am obviously very alive to the fact that the value of properties in Kensington and Chelsea are markedly different to other areas of the country. And by removing the need to sell the property for the care element, obviously excluding the sort of the housing cost, but the care element of it, might mean that we see an awful lot more people in their own homes being supported at home, which I think is right, but it's very hard to quantify exactly how many of those people there already are, because they're currently procuring these things themselves through the private sector. So I'm cautiously optimistic, I'd say, and I'm looking forward to seeing exactly how they're going to work the figures out, and to make sure that we don't cannibalize one market to feed another. We need a functioning market on both sides. So yes, I think it's a work in progress, but a positive step forward.
Thank you very much. That's quite, I hope you are satisfied with that answer. Councillor Atkinson, please.
Yeah. Just to finish off on that last one, I mean, I think your preliminary findings and report is really very interesting. But obviously, this is going to be a major concern for this committee for, I suspect, many years. And I hope that we as a committee will do substantial investigation and research and make recommendations ourselves, because you yourself listed 4 or 5 potential problems which we don't know the answer to at the moment, and to give everybody credit for it, it is new. I mean, well, it is new that it is finally being tackled. Actually, the issues have been around for 20-odd years, and it is a matter of great regret that it has become a political football. I hope that this is the beginning of a sensible approach to something which will make a very big difference to the lives of the majority of our residents. So I would encourage this committee to make this a really big issue, and we'll give you a much harder time if you don't have answers
next time. But if I can, I would like to go back to the COVID figures that we've got. And if I can start with a compliment, I do think the testing system that's been set up in the borough, and particularly in the Great Hall, has been absolutely excellent. And it's done very efficiently. People have a lot of confidence in it. I know the working population know that they can turn up to be tested and be out in 5 minutes. So I pay tribute to those who've organised the testing, and to those who have the rather difficult job of making us all do what we really don't want to. So, I mean, let me start off with that compliment. But, I mean, I have to say that, and we all understand the reason why, the figures for inoculations in London are really still very disappointing. And whilst I think the way we put our figures up is we're 4th or 5th best in London, but in which case I don't think we've done well, and I don't think other parts of London have done well. And I do recognise how very, very difficult it is that the capital city has got problems that other areas don't have. I would, in particular, I'm very interested in, I think a good way of improving our figures is to encourage the vaccination in the borough's secondary schools. And given that we don't have many secondary schools, I'm wondering in what role, I mean, I know we don't have a directorial role anymore with the schools, but are there ways in which we could encourage the schools? And far be it from me ever to advocate a league table, anything to do with schools, but I would be curious to know which schools are doing well in encouraging it. I mean, I absolutely recognise that not many, I think as Sir William says, it's not that we think that the children themselves, or the majority of the children, are at great risk, but they do serve to pass the disease on elsewhere. So I would urge that we look again and see what we can do to encourage the schools to push very hard to get their students inoculated. Now, I know in this day of academies there's a way in which the secondary schools are perhaps going to be resentful and say it's nothing to do with us, but one of the problems again I have with academies is that actually schools do have a responsibility for the communities in which they find themselves situated. So bearing in mind everything else, I hope that we will work very hard to encourage our schools to get involved. Now that said, to argue against myself, I do think that the system we had at the end of the summer, the whole bubbles system, was a complete fiasco, and I came across head teachers who were at their wits' end trying to follow a confused and ever-changing, and the idea of what if, the whole idea of a whole class being, or a whole bubble, which was often bigger than being sent home at short notice because someone might have had been involved. So I suppose I'm rambling at this stage, but I would ask, can we look, and would you agree, that it is one of the things that we could very quickly get an improvement on if we, not to put it any more strongly, if we encouraged our secondary schools to have a mass programme of inoculations?
Thank you. I fully agree with you. I believe KAA was actually a pilot school to get this going. Obviously, the rollout of that is still in its infant stages, let's say. Obviously, yes, in the same way we've tracked all the other figures, we will be looking at our child population alongside Councillor Rendell and how that impacts upon our wider case rate. I suppose to go back to your earlier point about London as a whole, I think I've probably raised this previously, but we were also, again, to blow our own trumpet, we were also one of the very first boroughs in the country that proactively was reaching out to people that hadn't been vaccinated. We had a call centre with GP permission, ringing people. We had a data sharing agreement with the GPs, And we were really making sure to understand the reasons, not to push anybody, but to really understand if there's something that we could do to facilitate it, to make it easier. The vaccine bus is something that does help make it easier, and that we can bring the vaccines to people rather than expecting them to come to the Science Museum, as it was. I'm hopeful that pharmacies will be able to step in and play that role in the future by being a local community centre, as I do believe that, frankly, we have to get used to having our boosters for the time to come, really. As with the actual percentages, I think the colleagues behind me will understand that this is a bit of a sore topic for me, because nobody wants to be near the bottom of a leaderboard, whatever you're counting. But in ringing those 17,000 residents, of whom I believe we got through to about 8,000, is a large number simply weren't in the borough anymore. They'd moved out, they had moved overseas, they'd returned home, they were registered elsewhere. And in percentage terms, of course, that impacts on your percentage, but in overall terms, as long as they were either getting their vaccine wherever they've now moved to, I suppose the end result is still positive. And so one can sort of argue that this is a data issue across the country, most acutely felt in cities of high mobility and high movement of people. Transient, that's the word I'm seeking, a transient population. And so we all know this from Kensington and Chelsea. People move in, they move out, or they move across streets. They could go from Hammersmith into Kensington, but if their data doesn't track, it's very hard to know exactly what's happening. And just from a sort of a local anecdote, my niece has graduated university, has moved back to London, but her GP records remain in Warwick. So her vaccine record will be linked to that property rather than to her home in London. So this can play out on an exponential scale once you take the entire population of a city into account. So we have to keep making sure that people who want the vaccine have access. We have to make it easy. We have to provide pharmacies, buses, whatever it may be, so that those who want it can have it. But we also have to make sure that those who do want it can get it very simply in the schools, especially, and also now with the booster program as it comes through.
Thank you for this comprehensive answer, and from Councillor Atkinson for that comprehensive literature there. I will call to Councillor Addenbrook first, then Councillor Spalding.
Thank you, Chair. And thank you very much for bringing this report. I think it's really helpful to see all your priorities, because it is a big area. A couple of things. One is on the Air Quality Action Plan. When do you think that this will be available, and will you be able to share it with us? And then one of my favourite topics, immunisations. I appreciate we're all concentrating on COVID, but we've got our NHS colleagues in the room, and I would like some assurances that, childhood immunisations are going on, and also whether we're looking at pneumonia jabs for over 65s, because I think that's probably an area that's quite important with people suffering from chest infections as we go into the winter.
Thank you. So the Air Quality Action Plan it actually sits within the environment portfolio, or planning, place and environment. That's something, it's a statutory document that expired in April. Obviously, due to COVID and everything, there's delays attached to that, but it is coming forward, and that's looking at our whole council approach to climate change as well as air quality. What I'm very keen to do is make sure that public health are feeding into that from a very early stage, which I know they already are, but that we can deliver some very clear actions pretty quickly, and yeah, pretty much as soon as possible, frankly, because air quality is something that isn't going to go away of its own volition, or poor air quality especially. So whilst the report itself may still be a few months away, I think we can move a little bit more nimbly now to start, especially around schools, getting on and looking at things like green screens around the playgrounds. The school streets have already been a great success in the transport department. There's an awful lot we can do whilst waiting for a wider report to come through. So I'd rather do the actions and let the report come rather than wait for the report, if that makes sense. And then to your point on IMS, I mean, absolutely. I mean, this was something the council historically had an issue with before we found ourselves at the bottom of the COVID leaderboard as well. We routinely had issues of measles, and something I know the public health team were already very actively engaged in. I'm hopeful that this recent public energy endeavour to get ourselves vaccinated will lead on to a positive IMS take-up of the other shots. Obviously, the schools are at the moment not only doing COVID, they're doing HPV, they're doing, there's flu shots coming around. There's an awful lot of vaccination happening, and I just want to make sure that we are targeting the areas that historically we've been a bit low on. We also have another issue of data in that it's very hard to access any private residence information. They obviously it's private, but it's also not taken up in a wider pool. And so one could just say, oh, but lots of people will be having their shots privately. But the wider concern could be that they're not having them at all. So we need to sort of break down that information barrier whilst also improving on our local rollout itself. And I don't know, perhaps if GP colleagues would expand on that in their section of the evening.
Thank you very much. You want to follow up on that?
Just on the immunisations, I still feel that this should be part of the school registration, that when a child is registered for a school, you should provide the vaccination information. But I know that's in a different department, but I do feel quite strongly on that.
Okay, points taken. Councillor Spalding, please, and then Councillor Woodger, then Christine.
Thank you, Chairman. Councillor Kamali, 2.7, primary care and GPs. This is a big worry to a lot of our residents. 2.7.1, it's about access to GPs and specifically face-to-face appointments. The last two sentences there say, this has included maintaining appointments face-to-face. The average across North West London is 53%. That's a bit unclear. Does that mean that we've maintained that 53% of all GP appointments have always been 53% and we're maintaining it? Or does it mean that half of our residents don't get the face-to-face appointment that they've requested, i.e. only 53% are getting the face-to-face and the rest are having to use a different method?
Thank you. You'll be happy to know that my comment in the margin there is down from what is what I've written there. So I think probably rather than me trying to speculate, it's probably best just to hear directly from the horse's mouth on this one.
Yes, Dr. Stephen, please.
Yes, so I think what I would hate to put works into Councillor Kamali's mouth, but the access to GPs has been maintained. In fact, access to GPs increased over the last 6 months. We're seeing 30%, well, we're not seeing, but we're in contact with 30% more patients than we were this time last year and pre-COVID. The 53% is the number of consultations that are between virtual and face-to-face. We are still working on the accuracy of that number. NHSE's current guidance, and it keeps changing all the time, is that we should aim for 50-50 between the number of patients reaching out to primary care and the number that are face-to-face. I think a lot of patients, I know there's some anxiety about the numbers of face-to-face appointments that patients have, and if you believe some of the press, there's a lot of mistrust about that too, but a lot of the population are very happy with virtual consultations. It's very convenient. As we heard from Brunel, there is some evidence that digital contact does seem to help with some people. So 53% is currently an increasing number, and we hope and trust that it does allow those people who need a face-to-face appointment to get one.
Councillor Woodger, please, then Christine. Yeah.
Thank you, Chair. All the work that's been done to target obesity is really good, all the physical activities in partnership with the NHS. But what I'd be really curious to know is, they say bodies are made in the kitchen. What sort of plans are there for diet education? Because I mean, I always think when you go, you know, the supermarket, all the naughty foods are right by the checkouts. They're all there. They're all very tempting, and they're cheap, and people buy them and eat them. And it's all, I mean, I always think dieting is all about self-control, and it's all starting at an early age as well, where, you know, people. If, like, for example, for myself, as a habit, I would have salad, you know, with my dinner, and I think if people can gain this throughout their lives as a habit, as opposed to it being something they, you know, feel compelled to do, that would help. So yeah, I'd be curious to know if there are any programs for educating people on sensible dieting.
Well, I mean, I absolutely agree with you, even if our diets may be slightly different. But I would say that, you know, we are obviously part of the National Change for Life programme. My predecessors had a very successful program in Goulburn, in the Goulburn program, which was addressing exactly that. It was taking away the chocolates from the child height by the till. I think what we're trying to do here is we've sort of acknowledged that obesity is a national issue, and what we've been doing to tackle it perhaps has not got us quite as far as we want to. So we've tried to look at it again and say, well, actually, what would make people want to do more exercise, and what by asking them, we could actually then put in front of them things that they do want to do. So I know we had this in the council meeting a few months ago, but actually, you know, we ran a survey and people wanted table tennis. They found it enjoyable, and so we're working to make sure that can be provided. As I said on the night, I don't think it's something anyone would have been able to design by committee, but it is something that actually, by asking our residents, we can helpfully encourage them to use. And I think this is sort of a wider part of our responsibility as a council, is that we have to offer people the opportunities to make those good decisions themselves. And there's been a slight sort of top-down approach to obesity, where I think we can work much better through our schools and through our younger population, because I think once those sort of lifestyle choices have been made, it's that much harder to break them at an older age. So by working with Councillor Rendell, we are working through proposals for our schools to try and see exactly what we can do. We're acutely aware of the difference in obesity of our 5-year-olds going up to when they're 11, and that's really interesting, because most of their food decisions will be based in the family. They won't be procuring things themselves or buying them in the shops themselves. So more work has to be done on that. But I think we also need to expand with the leisure side of things and make sure that we do take advantage of our amazing parks and all of our outdoor space and really make it fun to get fit, in effect. So I can stand by the fact that I've also just recently bought a bicycle, so I'm doing it, I'm living what I preach. So let's see.
Thank you. That's living by example. Well done, Councillor Kamali. Okay, Christine, please.
Going on to 4.4, what progress is being made on the provision of extra care housing? And going on from that, the review of sheltered housing, I mean, both of which are key in actually keeping people out of care homes.
Absolutely. So before even the health and social care levy was proposed, we had a council debate where we put forward a motion that we wanted to see a report as to our future planning in this sector. The architect of that report is sitting to my left, and I'm sure he can expand on it. But what we've seen already from the draft is that it's vast. The need within the council is absolutely huge. We have incredible demographic pressures. We have a very national, very low birth rate. We have an older population in Kensington. We have dementia as a fundamental issue that requires an awful lot of care. We want people to be able to stay at home, but that is not always necessarily possible, and so we need to be able to provide good quality homes for them with the appropriate levels of care and the appropriate design language so that they can move around the property as well. We're obviously a borough with very historic older buildings which weren't necessarily designed for a modern way of facilitating care. They're not necessarily built to have hoists and things which now are sort of de rigueur in these properties. Perhaps, Gareth, you want to just expand a little bit on the figures, your initial scoping, because it's still something that we are working towards to bring the paper back to the Council.
Sure. Thank you very much, Councillor Kamali. Thank you for the question. The work that we've been doing just over the summer is really trying to establish a baseline position from adult social care to the rest of the council and you know, more broadly to the borough around what our anticipated need is and how that growth will change over the next 5, 10, 20 years for, in particular, extra care provision. And as Councillor Kamali says, based on population projections, based on analysis of the forecast of social care need through Poppy and Pansy databases, and also through our own knowledge of the population, that growth is going to be quite acute, we think, in terms of both the need but also the opportunity. And I put it that way because the opportunity that extra care affords is both the opportunity for people to maintain independent living with their own front door. And it's their own tenancy, their own property, it's where somebody lives, it's their home. And we prevent people from needing at too early a stage to go into residential care, but also it's able to prevent high cost care packages in somebody's existing home which may not be appropriate. So it has lots of benefits to it in terms of the outcome for individuals, but also the economic cost to the local authority and to self-funders compared to the cost of residential care or home care. Our growth requirements will be met partially by when we get there the eventual development of a facility at Lots Road, which would provide us with 65 additional extra care units in the borough. The other thing that would do is allow us to look at the potential reconfiguration of some of the existing extra care units that we have in the borough, where we know that there is forthcoming demand, but we've seen a slight a dip in occupancy, partly due to the pandemic over the last 18 months. So we need to get that refilled, but it gives an opportunity to think about what's in the right space. So in setting out these numbers, we're also able to say to our planning and development colleagues, as social care, this is what we think we need for this cohort of the market, but this is what's required for people who don't yet need extra care but might be thinking about living somewhere else as they age. So helping people to be able to plan ahead and doing that through development where we might be able to increase or readjust the volume of sheltered accommodation that there is in the borough as a step that people might move into before they move into extra care. So, but really the key stage we've got to at the moment is being able to give that clear answer whenever there's a development happening or whenever there's an acquisition happening about what our need is, which we haven't quite had so clearly before.
If I could just also add that this is another piece of joint working with the Deputy Leader and Corporate Property, and that we've been slightly independent in the way that we've designed schemes, and that housing produced housing, adult social care looked after adult social care, but actually now we need housing to provide housing for adult social care, and officers will be working together over the next few months. This is obviously a very long-term strategy, but we needed this baseline figure to really show us the projections. I think this is something that the Council is going to be taking very seriously. I certainly am, as it's something that affects all of us effectively. At some point we will all know somebody that needs that little bit of extra care, who wants their home adapted, or they want to be able to move somewhere that's even more appropriate for them, and I want to be able to offer that to them. We also have a number of residents that are placed out of borough due to provision, lack of provision in Kensington and Chelsea, and so I would hope to address some of that by building that capacity in a very constrained land borough, which is why we're going to fight that much harder for any sites which are put up for sale by any particular mayors of London now or in the future. So thank you.
Thank you so much. I think that's quite a comprehensive discussion around the lead member report, and I think there is no more questions or follow-up. I think we exhaust this to some extent, since it is still in its early stages as well. There are quite the key priorities, quite extensive there, so wish you luck in achieving some of them at least, and I can see some of the highlight, which one you are starting with, and I welcome that cross collaboration to add value to what you are trying to do, and we'll keep an eye on that development. As Councillor Atkinson said, we'll keep a watchful eye on that development. So we thank you very much, and we conclude here this item. Just like we are expecting the next item on the agenda, the mental health in North Kensington. If you don't mind, colleagues, we have the team from the NHWL, CCG, waiting patiently there for us. So I will swap the item, if you don't mind, Councillor Williams. Yep, super. So may I invite the team from the NWL, CCG, to introduce that paper, and then we'll open it for a discussion, and we thank you for your responses on certain points, but it will be nice just to give us an overall view as well on these different elements, and then we'll open it for questioning. So who's going to lead on that? May I invite
Hi,
Simon Hope.
Thank you. Councillor. Obviously, the committee has the report which provides details of the CCG's response to the recommendations of the Select Committee. I wasn't really planning to go through section by section the content. I think that there's a lot here which would be very happy to discuss with members, so I think probably the best thing to do is just to open it out to questions, and we can talk through any queries that people have in relation to the CCG's response.
Right, thank you very much. I will appreciate that. So I will open it to the questions to the committee on some of these points. They kindly responded to us. So if you have any particular items for clarification, we welcome your input there. So who's the member of the committee who would like to lead on this? Christine?
Thank you, Chair.
Okay, thank you.
Thank you for your response. And there's a lot in this which is very positive, and we did ask you for a strategy, and that's what you've come back with. I mean, I think overall what would be really useful would be to have some ideas about how you think you're progressing in terms of implementation at the moment in this particular borough. And given that we're moving into a hybrid world where we have a mixture in all spheres of digital and face-to-face, what you see as being the challenges there and how you think you are being able to meet them. And I'll give you some of the things that we're hearing still a year on from when we originally produced, Health Watch produced a report and the Select Committee asked the questions. I mean, we are still hearing that people are having difficulty getting through on the phone. We are still hearing that some practices have a total triage, and then there are questions about who actually does that triage, whether it's done administratively or whether there's a clinician involved. We're hearing that whereas about a year ago a lot of people were very unhappy with e-consult, there is now a constituency that actually likes e-consult and that they are using it extensively and therefore building up a demand on GPs, given that they have to be answered within 48 hours, as I understand it, and that therefore that there's a worry about whether routine work, and particularly the monitoring of long-term conditions, is being left to one side. There's also a worry about accessing urgent care at a point when it's needed, and I think in one of the earlier papers there's a comment that people are going to A&E, so I think there's certainly still an uncertainty about where you go if you urgently need care, and a sort of subsidiary there would be good to know what's happening to St. Charles. So those are some of the questions around access that are still coming up to us, and I'd be glad to have some review from you of where you think you're at with it.
Thanks very much. I'm Andrew Steeden. I'm the Borough Clinical Lead, but we've got representation here from two of our local PCNs too. We've got Dr. Razik, Dr. Katz and Dr. Ramsden, so if there's anything I miss that they want to add, then I'm very happy to. The report itself was actually written by North West London CCG, so we as a group didn't have much input to it, but most of it we recognise and most of it we anticipate putting forward locally in the borough. Total triage is still the policy that's recommended to keep patients safe. That does mean that they can access face-to-face appointments safely or be signposted to the appropriate service safely. So it's not about creating a barrier, it's just about making sure that people are managed safely. I agree with you about the popularity of e-consult. It's creating a lot of demand, but is very convenient for people who've got young families or people who are working to get their problems sorted. So it is something that's quite popular. It will be going back to procurement because the e-consult project, I think, comes to an end at the end of this year. So the anticipation is that we will be reviewing the e-consult procedure. So hopefully it will be something that will be a little bit more seamless for patients and for families to use. A lot of the things in the report that you've got around children and mental health are projects that are being picked up and priorities that are being picked up by your local ICP, of which we are a part. And that's a partnership with you in the local authority, as well as the Community Trust, CLCH, CNWL, and the Byborough Local Authority and GPs in Central as well. We're all concerned about the management of long-term conditions and where the last 18 months have left us with this group of patients. So we recognise there's a backlog that potentially we have to pick up there. We are monitoring that, and particularly those diseases that are linked to health inequalities, things like diabetes. We can already see an improvement in the outcomes for patients in those groups, and we're able to monitor that and report it against individual practices and PCNs, and we can see a gradual improvement in that. In fact, Dr. Razik has been successful in being the first PCN in the borough to be a part of a national project on population health management to address diabetes in other areas too. So hopefully at some point in the future she'll be able to feed back to you how successful that is. We had a primary care summit which was an attempt to bring all of primary care together in North West London, and we had a local one as well, to see how we might address the pressures of urgent care going into the winter. And so there are a number of priorities that we have pulled out locally and across North West London to try and make sure it's easy for families and residents to access emergency care on the day. Those include hospital consultants in A&E being able to make appointments with GPs, 111 being able to make appointment with GPs, 111 also being able to make appointments with A&E. It's also been about primary care support for care homes, regular MDTs, expert clinical guidance for care homes over the weekend, etc. But there are a number of e-hubs, doctor visiting service. There's lots of schemes that we're using to try and make sure that we can address the urgent demand in the community. We're all very aware of the pressure that the whole NHS is under at the moment, and we're trying to make sure that we do our bit to make sure we aren't diverting any of the community care into other settings.
Thank you very much for this. Are you content with that answer, Christine? All right, thank you. This is good. No, it's quite good. I congratulate you as well on these engagement for the Primary Care Summit, which is timely so, in order to understand the wider dimension of these changes, because the NHS and the primary care is changing, and there is a lot of pressure on the system. So I really appreciate your work there. I will ask Councillor Spalding, please.
Thank you, Chairman. This is section 2 of the report, back to provision of face-to-face appointments. The new guidance. Does that guidance give target figures? I mean, is there a drive from the NHS to shift away from face-to-face? Linked to that question, on the next page, it says, as of March, 60% of appointments were face-to-face. Now, we know from the lead member's report this evening that currently face-to-face is down to 53%. So that's a drop of about 15%. So the number of face-to-face appointments are falling, and this is reflected in the feedback I'm hearing from residents. So my question is, this 15% decline in face-to-face appointments, three possibilities. Is it a genuine desire by patients to switch to digital because they find it more convenient and more effective? Or is it B, a lack of supply of face-to-face availability? Or is it C, what percentage of patients who request face-to-face actually get it? So is it a matter of demand, supply, and what's the true figure? How many people who want face-to-face are still getting it?
So I think we're potentially looking at slightly different figures here. So I'm not aware that in March that it's gone down from 60% to 53%, because that is not, I think we're looking at different figures based on North West London versus West London figures. So I think that is not an accurate reflection of what's going on actually
well,
on
we
our...
have been provided with those figures in these reports.
In this report, yeah, but I think that this report, as Dr. Steedon started off with, was the North West London figure. And then the 53% is a London figure on face-to-face appointments. So they're just slightly different figures. Well, yeah, because we can see the figures within our practices and our actual practices based on our PCNs on a very regular basis. And we are getting those reports down. Our number of face-to-face appointments are absolutely going up from March to now. There's no doubt about that. And those figures we can get for you. I think we have a number of issues. One of them is actually coding. Is that because everything went into what we call a telephone appointment slot, some of our doctors don't change those slots and they just write next to it F2F and they tell the patient to come in. So they don't change the slot type. So we definitely have a coding problem in terms of face-to-face appointments. A patient will call the practice and might not be given by the receptionist a face-to-face appointment, but they will speak to a doctor, and I don't believe any of our doctors, if someone requests a face-to-face appointment, won't give it. And I can see how many face-to-face appointments are happening. There are a lot of patients, as you say, that do not want it, do like the digital models. And I can tell you today, I saw someone in the vaccine hub who had a lesion. I saw the lesion and I called them back and did a digital appointment with them, because that's partly how we do our referrals now, on pictures and things like that. So there is a lot of face-to-face that is happening that you might not be seeing. So that's one thing. The other thing I just want to talk about the chronic disease management. We have, especially locally, Simon Hope and Andrew have put together a great scheme for clinically extremely vulnerable, where they're all getting care plans, proactive care, which is a really exceptional scheme that we are now calling in all of those patients to get care plans that wouldn't necessarily have them. We do have to do this safely because we don't have the... Not all premises are designed for COVID safe working, and you might not be able to have 50 people standing in my waiting room safely anymore, but we are timing it, and our practices are open very long hours to make sure that we can see patients face-to-face safely. And I just want to raise one further thing that was raised earlier, was about vaccination. For the first time this year, vaccination is part of the quality outcomes framework for GPs, which means that shingles vaccine, childhood IMS, etc., are all being very incentivised to get up to very high targets. 65 points of quality outcomes framework this year are based on immunisation. And that's not COVID immunisation, that's shingles vaccines and childhood IMS. And so therefore we are incentivising all of that. All of those people need to come in safely. But you can't underestimate that we still have quite high cases of COVID going on, okay? So we do have to remain safe. And we've seen within our practice, by mistake, already this week 5 or 6 people with COVID who'd done natural flows were negative but then did PCRs after they saw us. So we do need to find a safe way of doing this. But I think the face-to-face, once we get our coding right, we'll be able to give you much better figures.
Chairman,
Thank you very much.
The figures
yes,
are not
Councillor
right,
Spalding.
if the figures we've got in these reports are not right, perhaps we could have the correct figures.
Okay.
Yeah.
Thank you. Yep. Okay. Points taken there regarding the accuracy of the figures and to be updated. And I'm glad you mentioned, I need to, before I passed on the question regarding that we are still in a COVID environment, and it's worrying what you just mentioned there, quite hit. There is, so we need to be aware and cautious, especially now with the flu pandemic emerging. So this combination, I don't know, I really feel for you regarding what you are trying to provide as a safe environment for our patients. Councillor Atkinson, please.
Something in which I speak with the enthusiasm of a convert. When it first came out that we weren't going to be allowed to face-to-face appointments, I was absolutely furious and militant about it. But for a short period it was required for the reasons we've gone into. Having tried it, I'm massively in favour of it now. It saves me so much time. Now, I mean, I'm retired, so I've got time. And I am very aware that it's, health is the same as education. We all have a certain limited experience of things, so we tend to speak to it from our own experience. But I also have a large family, and the working members of my family are absolutely delighted to be able to have telephone reassurance. They send them photographs or whatever, and this varied way of consulting, I think, is increasingly popular with people once they've tried it. And it just does seem to me, don't bow to the pressure of the Daily Mail. They're completely wrong on this. The key is people should get the type of appointment that they want. At this stage, I want very few face-to-face appointments. I have a good relationship with my doctor. He trusts me, I trust him. As I say, the working members of my family are delighted not to have to drag off to the surgery. My very elderly mother still wants to see her GP and is allowed to, I mean, this is not in London, so I'm not stocking up to you here. She gets that, and actually she's found it easier to get appointments because I think the GPs are not spending their time. It was mad that you used to have to go and see a GP to get a repeat prescription. So don't give in to the pressure and just stick with the principle of give people what they want.
Thank you, Councillor Atkinson, for your relaying your personal experience. It's quite important to see how, on the practical front, the service being provided at the point of delivery for the quality. As long as quality provision is maintained, I'm sure the pressure on the system will be relieved for a quality service of those who mostly need it. So we trust the GP when you are in your hand, the same as in hospitals, and the different channels of provisions of services, whether it's telephone, different social media, interaction, Zoom, or whatever media for this level of interaction, as long as we maintain quality and the dignity of that provision, this is appreciated, and we keep an eye on this. So I will go for Councillor Bakhtiar. Do you want to one point to follow up, Councillor Atkinson? Yeah.
Priority now for different types of inoculation is also a very good thing. I got a flu inoculation yesterday, and they gave me a pneumonia one in the other arm at the same time. I now feel terrible, but I'll forgive you for that.
Welcome, and I'm glad you are here with us, having that good input. Councillor Bakhtiar, please.
Thank you, Chairman. I would like to talk about the mental issue. One of the points mentions about prevention, suicide and prevent in general. I have 3 cases. I don't think the NHS and the council are working hand to hand together to deal with these mental issue cases until this moment. Once somebody is diagnosed, a family member, a child, a partner, or any family member diagnosed in a household with mental problem, then that will affect the entire family. But until this moment, we don't have a package to look after the family. We don't have a package to take care of the entire family. We tick the boxes to look after the patient because we owe the duty of care to the patient, but nobody cares about the family. I have 3 cases, but I will mention one of them. A lady with 2 children, both of them, 5 and 6, diagnosed with autism, and the lady herself has some underlying health conditions. They live in a small flat. One of the children diagnosed with hyperactivity. He is hyperactive. He only sleeps 3, 4 to 4, maximum 5 hours. Otherwise, he is jumping and shouting and banging things. And the other is completely opposite. He wants peace. He doesn't like light, and he wants to have a room on his own. This lady, the only time she rests is when these children are out for 3 to 4 hours at school. While she is resting, she needs to clean the house, cook, prepare things. She is on duty 24/7. The council refuses to acknowledge this case and give her proper accommodation. So these 2 children live in separate rooms. They advised her, she lives in a 2-bedroom. The children could live in the bedrooms while you are resting in the living room. And the children are on her shoulders all the time. So I think this time to acknowledge that once a family member is diagnosed with a mental issue, the entire family needs care and proper care. Thank you.
Thank you, Councillor Bakhtiar, for this individual case being highlighted. I think this could be addressed on an urgent level with the relevant officers. Thank you for highlighting it. Any member of the committee on further questions on this? I have one question regarding this move into the integrated system, and we are relying on third parties to develop that system. So how confident? You mentioned in the paper the principles, the different principles, and how you are monitoring the suppliers, especially the data integrity, and the trust in the data and the patient's records. I know there are regulations, strict rules on how this is going to be monitored, because moving into more of this domain is going to be quite worrying, I'm sure, for most patients and the trust. So how these last elements there, for example, that you are going to ensure that all the suppliers are really going to be compliant with your strategy into this. Thank you.
Yeah, so so I think you're referring to some of the work that we're doing in partnership locally in the ICP. So this is a relatively new organisation that is actually working in shadow form at the moment and will come into full activity next April when the CCG ceases to exist. But there are a number of partnerships that have that are quite historic. So the way primary care works with mental health services and with CLCH has meant that they've been able to share data amongst themselves in a safe way to benefit patients and families as well. But there will be some questions about how we share data and how we monitor each other inside the ICP, and it might well be that as the ICP matures that you might want to invite James Benson to come here, who's the chief exec of the ICP, who might well be able to describe to you how we're planning to do that as we go forward. I think it's incredibly exciting that for the first time in my career we are bringing health and social care together and just talking about care generally, so that we can address just the type of issues that you raise around how do you look after a whole family and address an environment, because that has as much effect on someone's health as writing a prescription. So I'm quite happy with that going forward. But I don't have all the details for you, Councillor, so maybe we can bring it back at another time.
Okay, thank you very much. No, that's as long as it is in the... yes, Councillor Bakhtiar, you want to follow up on that? Yeah.
But I think I have been misunderstood. The reason I gave you this example to illustrate a bigger issue. We have an issue. I want your comments and your contribution to this. Do you think I am right by saying we need to have a package to look after the family when somebody is diagnosed with mental problems in that family? Thank you.
Do you want to answer on that, Dr. Steven?
So I wouldn't like to comment on other people's funding and what they were able to afford, but it's not unusual that we create a care package with our colleagues in adult social care and others. So I can see a situation in the future where we could create a package around a family. Autism and dementia, but autism particularly, is a project for the children and young people's arm of the ICP. So and that's being led, I think, by Bernie. Sorry, I've forgotten the full name. Exactly. So I think it's something that it's a problem that we're trying to unlock in partnership. So I agree, there's a need. I'm not quite sure what the answer is just yet.
Thank you for that honesty. I can take your point, Councillor Bakhtiar, that's when we are looking at the problem, if you are looking at holistically within all its parameters, rather than just treating the symptoms, this can emerge into a more or less like a rolling on complexity of other issues which we might not be able to comprehend. But I think lead member Councillor Kamali would like to come in to provide his view.
I just wanted to add, this has actually been something that we've sort of been discussing with Kim again, is around the housing allocations policy and whether or not we can influence the care need as part of that points-based system. Obviously it's his portfolio to develop, but I'm feeding into it to try and make sure that where at least the property is the issue, that perhaps we can value the points a little bit differently to make sure that people that need it for a medical reason rather than simply an overcrowding reason could perhaps have more points there, caveated of course with our very urgent housing need in the borough.
Thank you, Councillor Kamali. I think Christine want to come in on this point, then Councillor Atkinson.
Mine's a totally different point. I just wanted to come back to the question of the patient participation groups. The statement in this response that they are active, reinvigorated across northwest London, I think really isn't accurate. It would be good to know for West London how many you actually think are functioning as opposed to just nominal, and what steps you envisage in getting them up and running, and also at PCN level. I mean, I think that the whole edifice that is being built around patient participation going up to ICS level actually depends on these groups at practice level, because that's where everybody is registered and people are available. So, you know, just some thoughts on your progress on that.
So we encourage all our practices to have restarted their PPGs, and we have been informed that they have all restarted their PPGs. We do live in a different digital world, okay? So sometimes the PPGs are the way to interact with patients, but we have found that Survey Monkeys have been extremely good at getting answers about whether patients are, why they don't want a COVID vaccine, or what type of consultation they prefer, or how they'd like their appointment system. So we found that as another good way. And actually it was very interesting, the talk. We are going through all the Facebook groups, as well as obviously the tweets, but some of the Facebook groups, especially near Yasmin's PCN, which is in North Kensington, Ladbroke Grove, they've got about 10,000 people on them, and we are looking at their feedback. They're not necessarily advertising their feedback, but we are looking at their groups all the time, and they're mentioning, I got a good GP appointment here, or I didn't get a GP appointment there. So it's not just the PPGs we're looking at, because PPGs attract a certain type of person, and different type of people use different forms, and so that's why we're trying to do that. We're also looking at Nextdoor, we're looking at WhatsApp groups, we're looking at mothers' forums, we're talking to schools, etc., to try and get a more rounded view. But we are, of course, all practices have told us that they are back doing a PPG, and I was at a PPG yesterday. In terms of the PCN level PPGs, it's much more difficult to do them digitally. We were starting them pre-COVID, and we will be redoing them, but it is quite difficult to get large numbers of people in rooms at this current time.
Thank you very much. Mr. Hope, please.
Thank you. Yeah, I think that the reality here is that the numbers changing all the time as far as a specific figure. It was definitely a consequence of the pandemic that practices in some cases weren't able to continue with their PGs, as you'll be aware, Christine, and those that didn't are certainly working hard to get them back up and running again. And the CCG team is working with those practices to support them. And I think it's important to say that North West London has made PPG development a key priority with funding attached. So there are 3 national priorities for PCNs, and the local one, which regions are allowed to add in North West London, is PPGs, and I think at a PCN level, PCNs will be supporting individual practices, and as Naomi said, getting also PCN level engagement for up and running. So I do think that it is a key priority. As Naomi's already said, I think that the form that PPGs take will change over time, for all the reasons that we've already heard this evening, in that technologies, meaning that there are newer and in some cases different and even better ways of engaging about certain things with patients than the sort of traditional face-to-face models, but they still have their own place, of course. So certainly we are very keen to continue to work very closely with HealthWatch on getting PPGs consistently back up and running across the patch. And as I said, as a part of the PCN development plans, we're very confident that that is what will happen.
Thank you very much for this. The last question, Councillor Atkinson, please.
Thank you, Chair. I just wanted to come back to support Councillor Bakhtiar in the case that he rose. I'm aware of the case as well, and I've also made representations. And the fact is that the problem of this family with their autistic children is entirely down, that the solution to it is entirely their housing needs. The mother could cope, if she got the housing. And I've been on the council for a very long time, and I'm still getting the same replies now from the housing department as I did 20 odd years ago, and it's a stock reply. Oh, there's 2 children of the same sex, you've got 2 bedrooms, you can sleep in the sitting room. And that is the answer they gave me 20 years ago. They don't take any notice of the medical arguments at all. And yeah, in some respects, I recognise the problem that the housing department has, but the fact that they clearly know nothing about autism, rather than send, and both Councillor Bakhtiar and I provided detailed responses. We got qualified people to send them in, and we still got the same standard replies I got 25 years ago.
Thank you, Councillor.
So I really do urge you to talk to the housing.
I think that's already highlighted by Councillor Kamali, and this could be repeated somewhere else. So this needs a comprehensive approach, and that's what we've taken from Councillor Kamali in terms of that comprehensive view. So thank you for that follow-up, and thanks for the team for your input into this debate, and we really wish you luck in that development, and the challenges you are doing and going through is greatly appreciated, and we wish you all the support in a safe environment as well. So thank you for your contribution for tonight's discussion, and thank you. So here we concluded this item on the agenda. We move to our colleagues who led the mental health initiative in North Kensington, and we are going to ask Councillor Williams to give us a brief update. Thank you.
Thank you, Chairman. I'd like to introduce first James Diamond, who has joined the scrutiny support team and is working with this committee and I believe the Environment Committee. And I think he's been working mainly, if not entirely, in respect to this committee's remit on this project. And I'm pleased to say he comes with a wealth of experience in scrutiny support from another London borough. The context, I think, as members know, is that this idea has been around since before October 2020, and the pandemic and lockdown, I think, has led to delays. We've also found that there's been a lot of consultation going around in the community on related topics, both by the NHS and the council. And so what we decided is that we would start by contacting community organisations, and I hope that I will get round a letter, a revised draft for a letter to go out to them quite soon, but we're very conscious of the time, as it must conclude with a report to this committee in March of next year. I'm also very keen to make direct contact with some people who come to this committee or attend other meetings who clearly have a particular interest in this issue in the community. And we'd also like to find other ways of engaging with the community, and I was interested in some of the comments made earlier about the use of digital media, and I very much hope that the councillors in North Kensington will help us. As the paper says, the emphasis is very much on community engagement first. I have had some suggestions that perhaps we should spend a lot of time talking to the NHS and to providers first. But yeah, I think we want to go to the community first, and then we go back to the providers and say, this is what we're told, what are you going to do about it? And then from that thesis and antithesis, we will get a synthesis. Yes, time is of the essence with this project. I'm happy to answer questions on it. The members, I just like to add, it's not in the paper, but the other members of the group are Councillors Atkinson and Addenbrooke, and also Councillor Idris. Thank you.
Right. Thank you very much, Councillor Williams. It's a very challenging task, I know, and I extend the welcome to James, who is joining us and providing the quality support we expect from his experience. So we welcome you to this committee, since now mentioned by Councillor Williams, and I hope the support that group addressing the mental health issue in North Kensington, although it's going to provide a focus, this could be spread across the borough later. But within the current context of easing the pandemic, I think visits and perhaps getting some maybe working groups in a safe environment, this might be accelerating that level of engagement. And as a councillor in North Kensington, of course, I will assist as much as I can as well from my personal experience with the local communities there, and we'll make that project a success, because the mental health issue is not going to go away, it's not going to ease, and the consequences of the people losing their jobs, other factors emerging with COVID, although it's challenging and it's problematic to some extent, but we can see it as well as providing other opportunities for us as a council. Thanks for that brief and all the work the working group is doing, and we appreciate that. And personally, I have no further questions to ask the committee, to the working group at the moment. Councillor Addenbrooke, do you want to comment on this, or any other councillors? Councillor Spalding, please. Yeah.
Could I ask about the methodology of this? As a layman, I mean, my knowledge of this area of medicine is, a layman's knowledge, but I am aware there are two distinct threads. There's what you might call individual, acute or chronic psychiatric problems, which are unique to individuals, and they are real illnesses. And there is a whole body of medicine that exists to treat those illnesses. But then there's what you might call sociological malaise. There are group mental health problems which have a social basis, and they're possibly not so acute as the illness, that they are more like a lack of well-being, or that they are a malaise, or perhaps emotional, or alienation, some sort of sociological alienation. And I think these two are very distinct. And I've just wondered, is your methodology allowing for this? Because, okay, there could be widespread sociological basis of a feeling of ill health, but there could also be genetic or sociological factors that are actually statistically giving more acute, serious psychiatric illness as well. And have you made that distinction?
Actually, may say, Councillor, I think there's a slight misunderstanding about both the purpose and the methodology of the study. This is not an academic study. It is not a clinical study. It is a study or piece of work carried out by and for a scrutiny committee, and it is looking at what people think of the mental health and well-being services in North Kensington. It is not looking at the state of mental health in North Kensington. As I say, my ambitions are fairly modest. I just want to try and understand what's working, what could work better, and try and get some improvements.
Yeah, thank you for that clarification. Yeah, it's we are looking. The group, I understand it, is looking at the provision of services and the accessibility to it and how effective it is. And yeah, that's it. So that's maybe the methodology, maybe, or after, is in what direction that group is moving. So that's being clarified. Thank you, Councillor Williams. On that, anybody want to, from open to the floor, to ask any questions on there? No, thank you very much. Much appreciated, all the work and your team on this task. I would like to move now on to the item A8, which is the work program of this committee. So if we look at the program, we have 3 more meetings left, and that's been highlighted in a diagram, in a table, where we agreed. So the next meeting will be, if I open the work program, James, do you want to take us through this one just briefly, or do you open it to the committee for approval?
Thank you, Chair. Just to say that this report sets out the priorities that the Select Committee have identified for the rest of the municipal year, and also sets out when those priorities will be looked at the remaining Select Committee meetings. Thank you.
So this is the work program, what we are agreed to do, and we are following it in the time scale, the short time scale we are facing over the next year, especially taking into account the developments of the integrated service, the changes in the NHS, and the council, the challenges we are facing here. So I seek the approval of the committee for this working program. The next meeting on the Wednesday, the 15th of December, these are the items we proposing to discuss. And so if you will approve it tonight, that will be really appreciating, so we can get the officers on it and progress with it. So, committee? Yep, super. Thank you very much. So we approve this working program, we stick to it, and we get our officers working with us to aim to achieve and this will give us time as well to our lead member to prepare well for the various issues there. Of course, I'm sure I expect the best quality for the presentation, more data, more scrutiny into data, and quality data. And we thank you all for tonight's contribution. I will have no more to say except if there is any other business committee want to raise at this point. So we'll finalize our committee meeting tonight. That's great. Thank you so much. So we finished this meeting at 20:51, and I'm really grateful to all your contribution, to the officers and to the everyone, and to the honesty of the lead members, working close collaboration across the platform, and taking our scrutiny in a big heart. And we thank James and Yasmin for all their work to support the committee. And thank you. Have a pleasant evening.